Hello everybody and welcome back to my channel. My name's Amy if you are new here. If you've just randomly clicked on this video, then you either really want some information or you're just really curious. But either way, please stick around. Please subscribe to this channel, give this video a massive thumbs up and share it if you can, because I think it will be really helpful and beneficial for a lot of women out there. Don't forget to also grab yourselves a cup of tea. So I just wanted to start off by saying I am in no way medically trained. I'm in no way any sort of medical professional or anything like that. I'm just a girl who had some abnormal smear results and some abnormal cells, who had to go for a colposcopy, a biopsy, and went through all of that. And I just wanted to share my story with you and make this video in the hope that it will help you. I'll also link somewhere my smear story video, which was the first video I did around this topic, and I wanted to just do a follow-up video more in depth about colposcopies and what to expect and how to prepare for them. If you are worried, then please don't hesitate to message me. All information discussed in this video and my Instagram will be linked in the description box down below. I realised that there wasn't really enough information out there, so I just really wanted to get as much information as I could and put it together into this video. A lot of advice, because everyone will say as soon as you get that letter that you have to go for a colposcopy, all they'll say is, oh, you'll be fine, you'll be fine. But they don't understand that, to be honest, that's reassurance and that's great, but it's not advice and it's not actually telling you anything that you really need to know. So that's where I come in, and I just really hope that this honest video will help someone, and if it does, please comment down below, or if you're worried you can always message me on Instagram as well. A colposcopy is a follow-up appointment from your smear. So you will have had your smear, you will have got another letter, and that will have said that you potentially have HPV, abnormal cells, or maybe even something completely different. Whatever it says, they want a closer look, basically. Check whether there are abnormal cells and also how serious they could be. So the likelihood of you having cervical cancer is probably pretty low. I say probably only because I don't want to say that it's very low and then, you know, I'm not a medical professional. But when I went there, they said that smears and colposcopies aren't searching for cancer. They're searching for things that could potentially lead into cancer. They're trying to prevent it, basically. So it's helping you at the end of the day. So it's so worth going, so please do not be scared. So to prepare for a colposcopy, I personally wouldn't, or would try and avoid Googling too much. You'll be given one of these leaflets through the post, which are quite helpful because it's obviously the NHS one, so that is going to be like real information, and I wouldn't really listen to people because there's going to be a lot of people that are going to say like their smear was the worst thing in the world when it's actually fine. Like obviously contacting them if you want a female colposcopist, nurse, doctor. Also to let them know sort of engage when you're going to be on your period. You can actually have this this procedure while you're on your period, but I definitely wouldn't, because I just think you'll be a hell of a lot more comfortable, and it will just be nicer to have it when you are not on your period. I actually personally track my cycle and I track my periods and everything like that on an app using an app called Flow. Really handy. I actually use that instead of contraception. I'm not saying use it instead, but I use that instead of contraception. So I would keep an eye on when your period is coming, when it's likely to come, because you may have to change your appointment to sort of suit around that time. Also, the other thing is to not have sex or use any vaginal medications, lubricants or creams 24 hours prior. Like advice would be as well to definitely wear either a panty liner or even a pad, because there is going to be some leakage, there may be some blood, and that is completely normal. So please do not panic, because I even bled after my smear and that is also completely normal. And I would say, yeah, definitely a panty liner, maybe even a pad, maybe just take a pad with you. For me personally, they actually had sanitary towels that you could use in there, because after they do it, you get a moment to sort of clean yourself up. After a while, obviously, they wouldn't make you get up straight away, and you get to wash your hands and kind of just, you know, it's very relaxed. It was very, very relaxed. I would say wear comfortable clothing, definitely prepare what you're going to wear. I would say personally, what would you wear to an airport? You would wear something comfy, something easy, and maybe sort of tracksuit bottoms and trainers. I would say whatever you'd wear to an airport, wear to your colposcopy. Something easy, comfy, yeah, something like that. And also, top tip is definitely take a bottle of water with you. 1,000,000% take a bottle of water, because you will need it, because I got so thirsty. Also, don't wear layers. I wore layers and I was melting. I went into shock because I was overheating, and obviously everything that was going on at the same time, which we will get to. Yeah, I did definitely go into shock. It was terrible. So don't make the same mistakes that I made. I actually had chewing gum. It did help me just having something to kind of chew on, but also it didn't help me in the sense that I then had to get rid of the chewing gum, and with the whole COVID situation I felt really bad asking. So it's up to you, but it's just sometimes nice just to have something just to distract your brain a little bit. Obviously you're allowed on your phone, so make sure your phone's fully charged. If you're going to go on your phone, you could always put headphones in. I didn't personally, because I was talking so much to the nurses that I wouldn't have even been able to listen to music, because I would have felt rude. Usually you would be allowed to take a family member, friend, partner, whoever in with you, but under new COVID restrictions, I don't know if it's changed, but you obviously won't be able to. But personally, I was absolutely fine. I wouldn't feel the need to have anyone else in there, because I had the 2 nurses and the colposcopist. That's already 4 of us. That's like a party, do you know what I mean? You don't want to add anyone else to that situation. And so, as I probably said in my last video, my smear story, I think I vaguely went over what a colposcopy actually is. So like I said, it is quite similar to a smear, but it's a little more in depth, and it's a closer look at your cervix. So it's similar in the sense that they're just going to be popping something in there to have a look, but it's more in depth in the sense that it is obviously in a hospital. You will have your legs up in stirrups, and I'll insert a picture, and they basically will have a chat with you first. Obviously everything, you'll be made to feel really comfortable. So in the room with you, you will have in front of you, quite low down in that area, you will have the colposcopist. You have 2 nurses as well, and they were absolutely lovely in my experience. And they're just there to sort of moral support for the colposcopist, sort of assist, and also to make you feel a lot more at ease and a lot more relaxed, which is really helpful. For me personally, my colposcopy and biopsy was on the 2nd of December 2020, and they were sort of trying to get me talking. They were talking to me about work, they were talking to me, like asking me loads of questions about to do with my job, and basically just chatting about Christmas, about, you know, like Christmas shopping. We had Christmas music on. The picture that I just showed you was actually after I had it done, which I'll go into more detail, but I did want like a better picture than that. But obviously at the time, like obviously I wasn't really feeling amazing, so I didn't get a better picture, unfortunately. But yeah, so you'll have the colposcopist in front of you, the 2 nurses, and then the screen behind you, all pretty relaxed considering you've got your legs in stirrups that are wide open. Open you up, just literally, not open you up as in surgery, open you up as in like they do with the smear. And you just have to relax, and you just have to literally just not think about it too much so that you don't tense up. Same with the smear. They insert a brown dye inside you, which sort of lights you up a little bit. So it displays all of your abnormalities in your cells. So they'll be able to see straight away because it comes up on a screen behind you, which I'd obviously recommend not looking. I didn't look, they told me not to look. And basically the little, I'll call it a wand, the little colposcope or wand that goes inside you has like a little magnifying sort of camera, and that will show the colposcopist, which they'll be able to tell straight away, and they're really confident and they know exactly what they're doing, they know exactly what they're talking about. So they'll be able to see straight away usually. Sometimes they might want to do a biopsy, a little piece of your cervix. It's only very small and it's not very painful. It's just a bit of a pinch and a bit of a tug, and you might feel a little bit of stinging. And then obviously afterwards you'll feel a bit of cramping. I would obviously recommend painkillers because mine was pretty painful, but I am very narrow, if that makes any sense. I'm quite small in that area, so my smear hurt me, so you know. So I would definitely recommend taking some paracetamol. I couldn't actually take any paracetamol because of the medication that I'm currently on, and I will do a separate video. I know I've said it before if you've watched previous videos of mine, but I will do a separate video on why I'm unwell basically and what I have, my full diagnosis, treatment and everything like that. It's nothing to do with cervical things. So you'll be sort of laying back, you know, you'll have everything out in the open. You'll probably be really comfortable with everyone in the room by this time because obviously they'll be in that area for a little while. The whole procedure, all in all, will probably take about 15 to 20 minutes maybe, sometimes not even that long. Mine was really quickly to have it actually done, but I didn't leave personally for a very long time because I was a risk, because I did not feel well at all. I went into a bit of shock. I felt very faint, but this is obviously just me. Nothing ever goes smoothly. So yeah, if you want to hear more about that, then go watch my smear video because I talk about it a little bit more. But yeah, that was crazy. I never had anything like that done before. My body just didn't know what was going on. But yeah, so you would have had it done. You may have been told to have or offered a biopsy. Itchy, a little bit stingy, maybe a little bit sore. You would have felt it a little bit. It's just a little clipping. That just sounds gross, but a little clipping of your cervix just so that they can go and test it and check it. So after that's all done, they will tell you it's done. You'll still be in the position and they will say what they said to me. They may not say it to you in the same way. They told me that they were inserting a fake scab, which even the thought of that makes me go, ugh, like that's just terrible. A fake scab. But basically it promotes the cervix's natural self-healing. So it makes it think that it needs to heal because there's a scab there. So say for the same instance that you cut yourself, your skin will scab over because it's healing. So that's what the fake scab is essentially for. Sort of the initial, everything's getting done, and if you have the biopsy, obviously where they clip and where they tamper with is near a nerve, they told me. So I was in there for a very long time, let's just say. So I asked a lot of questions and I got a lot of information in this time. Considering how faint I felt, I absorbed a lot of information. Because I did tell them that I was going to post a lot on Instagram and promote a lot about smears and things like that, which they loved, so they were happy to talk to me. Obviously this isn't very technical, but let's just say this is the nerve, this is where they clip, so it's very, very close. So it's completely normal and natural for you to feel lightheaded and faint. When they first initially asked me if I felt lightheaded and faint, I was like, I feel fine. Then not even 20 seconds after, it just hit me like a ton of bricks, and my head just went so funny, and I tried to get up and I couldn't, and they were telling me to lay back down. They were like, oh my god, lay back down, lay back down. And yeah, I just went a bit loopy, I think, in that instance. But that is completely normal. That is completely natural reaction. It's just your body's way of, I don't know, it's just your body's way. It's just how things go, you know. So you might feel, yeah, faint, lightheaded, but they'll insist that you stay there. Well, they definitely insisted with me because I was a risk, because basically I was going to get a taxi home, but I couldn't. So luckily I managed to call my mum and my stepdad to come get me, which they managed to do. Obviously masks in the car, windows open, etc. because this was in December. You just need to chill. You just need to take a minute for yourself. You know, your body's in shock. You're probably processing what's just happened. It is a big deal at the end of the day. It might not be big surgery, but it's still a big deal at the end of the day. So straight after, me personally, I started, they said obviously you'll get cramping after, it's completely normal. And yes, I did. I got a lot of cramping, and it was very intense and it was very sudden, and it did actually take me by surprise. It just felt like really bad period cramping, but again, that's completely normal. And again, you may not experience that. There's some people out there that probably didn't experience that or don't experience that, and especially more so if you're able to take paracetamol, obviously you won't feel it. Whereas obviously me being me, couldn't take it. I did feel it and I was in a lot of pain. But obviously if you had, you know, obviously periods before, and definitely if you've had childbirth, you will be completely fine. It is just because I've only experienced bad periods. Personally say, just, yeah, take it easy. The period pain type cramps will ease eventually, and you know, I would just say as soon as you get home, make sure you eat something just to keep your levels up and just to keep yourself hydrated. Try maybe lay off the caffeine, because I don't know if they actually said that to me, but I just don't think it would help anyway. I would just, yeah, and obviously not that you would go swimming straight after, but you obviously can't go swimming straight after, and yeah, things like that. So just take it easy for at least the rest of that day. Mine was really early in the morning, so mine was like 9, I think. Hot water bottle all the way. Anything that will relax you, so basically just chill. I just put the telly on. I think I watched New Girl, and I just literally just chilled out with my hot water bottle. I had a nap because I was exhausted, because it's emotionally exhausting, because you're obviously anxious before, you're worrying, you know, you're panicking a little bit, and you don't know what to expect. But hopefully this video, you will know what to expect, because it's called Colposcopy, what to expect. I did say wear a panty liner or a pad. Definitely wear at least something just in case, because something's going to come out, because they've inserted something in, if that makes sense. So what goes in must come out. I'll talk discharge, I really don't care. But yeah, I would recommend panty liners for at least a few days, if not week. Because you will get some strange discharge, for a little while. You will obviously get the jelly and the dye mixing together coming out. You might get some bleeding, you might get some irregularities, and also it might affect your periods as well. They might be a little bit heavier than normal, they might be a tiny bit more painful than normal. Obviously go by what your doctor says to you. You should be fine. I have had I think 3 periods now since, and the first one was really bad because that wasn't long after, and then the other 2 were just a bit heavier than normal. But yeah, I think they're coming back to normal. I have just been generally just a little bit more, I hate to say it, but a bit more leaky and stuff. I won't go too much into that. But also, one more disgusting thing before we move on. I mean, it's not disgusting, it's natural, but I just have to say it. I had a liquid bandage come out after, I would say a few days after, maybe nearly a week after. Just don't be alarmed if that does happen to you. I did have to Google what that was because I was definitely alarmed. Some good ones, I think Always are the best. They're quite the thick ones. These are the best, the Always, and they are quite big. These are the ones that I use. I still use them now, like up until like normally I only bleed for about 4 days, I would say, and now I'm bleeding or leaking for about 7. So like I said near the beginning of the video, I'm obviously not medically trained, I'm not a medical professional in any sense, but what I will say, obviously after you've had your colposcopy, if you don't feel like you're going back to normal and you have these things, then you will need to contact your GP, or they might give you a little card with their number on which you can contact them directly, which they did for me. And these things are heavy bleeding, bleeding that does not stop or go away, vaginal discharge that is unusual or smells, pain in your tummy or lower abdomen that does not go away. So any of those things, then please go and contact your GP or the person that did your treatment, because it may be something that needs to be looked into a little bit further if you're not healing. But like I said, I am not a medical professional, so you will not be able to ask me anything like that. That concludes the video. I really hope that I have done this justice, because I was really worried that, I don't know, I was just so stressed about doing this because I just needed it to be perfect. But I really hope that this has been informative, this has been helpful, and that this gets a little bit more awareness out if I can. So please share this video, and any of your friends that you know are going through something like this, then please show this to them, and hopefully this will put their mind at ease. So I really hope you enjoyed this video. Please give it a massive thumbs up, subscribe to my channel if you haven't already, because I'll be really grateful. And thank you so much for watching. I'll see you very soon, I hope. Bye.